So good afternoon, everyone. Thank you for attending. This is our CVS Caremark presentation for open enrollment. And before we get started, just a few gentle reminders. Please hold all questions at the end and post them in the chat. And we will certainly do our best to address those questions at the end of the presentation. Please keep the questions specifically related to the presentation at hand, which would be the pharmacy benefit through CVS Caremark. And we are recording this session. We also have another session at 5 this evening with CVS Caremark, and we will pick the best session and post that on our open enrollment webpage beginning tomorrow, just so folks can use it as a resource. All right, so that said, I'm going to introduce Lindsay from CVS Caremark. She will be our presenter today, and I will hand it off to her. Welcome, Lindsay.
Great, thank you, James. So thanks for coming, everyone. My name is Lindsay Neves. I'm the Strategic Account Executive for CVS Caremark for Prince George's County Public Schools. So we'll run through the prescription benefits overview today. And so to start off, I wanted to give a quick overview of CVS Caremark and who we are and what we do for PGCPS. So CVS Caremark works with Prince George's County Public Schools to provide you with prescription benefits. This includes determining what medications are covered under your plan, how much you'll pay for those medications, and where those prescriptions can be filled. CVS Caremark also provides members with a number of tools and services to help you stay on track with medications and take care of your health. So we'll review some of those tools and resources later on in the presentation. So to start out, I wanted to talk a bit about the formulary and formulary changes for 2022. So the formulary is a drug list. It's the drug list of approved medications for your plan. And quarterly, CVS Caremark reviews and updates the formulary, with the majority of those changes taking place for January 1st. And so those changes are reviewed by a committee that makes sure that there are covered drugs in every classes that are clinically appropriate and that there are cost-effective options on the formulary. So as I mentioned, there are some times where changes are made to the formulary. And if you're impacted by a negative formulary change, meaning if a medication you're taking is being removed from the formulary, you will be notified by CVS Caremark of that change. So you'll be notified 60 days in advance of the effective date of the change if you're impacted by a negative change. If you are a member on a specialty medication, which I'll talk about later on in the presentation, you also receive a live outbound phone call from our specialty care team to make sure you're aware of that. And at the bottom left of this screen is a screenshot of the CVS Caremark website, and it shows where you can find the covered drug list or the formulary that I'm talking about. So if you're curious of a medication that you're being prescribed is included on the formulary, I'd refer you to the Caremark website under the plan and benefits section, where you can click on the formulary and see the list of covered medications. So another type of change are tier changes. This is when a medication changes from preferred or non-preferred status. So there can be positive or negative changes. When there is a negative change, meaning a medication moves from preferred to non-preferred status, members will be notified of that change with that letter, as I mentioned, 60 days in advance of the notification date or of the effective date. And members are notified because this will impact the out-of-pocket costs for members. So if you are impacted by a change, you will be made aware of that by CVS Caremark. As a reminder, generic should always be the first line of consideration when you're being prescribed medication. So we always encourage members to ask their doctors or prescribers if there is a generic available when they're being prescribed a new medication. Generics can help save members out-of-pocket costs. And as a reminder, they're made with the same active ingredients as brand name medications. They are just going to cost a lot less. So CVS Caremark also has digital tools like our check drug cost tool, which I'll talk about later, that allows members to search for generic alternatives. But we always suggest that members have those conversations with their providers or doctors when they're talking about a new medication. And so with just this slide talks a little bit about where you can fill your medication. So with maintenance choice, members can get their medications, your medication, maintenance medications that you take regularly. So these are medications like high blood pressure medications, medications for diabetes, asthma, things that you take on a regular basis. You can get those filled in a convenient 90-day supply through CVS Pharmacy or CVS mail order. So we encourage members to explore their options and use a CVS Pharmacy to fill those 90-day prescriptions. And to find a CVS Pharmacy near you, you can use the pharmacy locator tool, which is on on Caremark.com. Mail order is another convenient option that members have access to. So you can have a 90-day supply mailed right to your door. So it's convenient, peace of mind. Those prescriptions are filled by a licensed pharmacist, and you just have the flexibility to manage your orders of where it should be delivered. So we encourage you, if you have a prescription that you're currently picking up at the retail location, but would like to switch it to the convenient mail order 90-day supply, there are resources available on our website to convert a prescription to mail order, or you can always call our customer care team for help with moving a prescription to mail order. And as a snapshot, here is an overview of the 2022 benefit summary for PGCPS. So you can see that if you're picking up a supply of medications, like typically a 30-day supply, you'll pay the associated copay here, whether it's a generic medication, preferred brand, or non-preferred brand. And so again, this is another example of why we're encouraging members to have their conversations about generic availability, because it will save you in the long run, as their lowest out-of-pocket costs are associated with generic medications. Should you choose to fill up to a 90-day prescription through CVS mail order or CVS pharmacy locations, you'll save money by filling 90-day supply and paying the applicable long-term copays. So you'll be paying $20 for a 90-day supply for a generic medication, $80 for a preferred brand, and $140 for the non-preferred brands. So really suggest having that conversation and looking to have your prescriptions filled through mail order or CVS Caremark. There's a maximum out of pocket, which remains $1,500 for an individual and $3,000 for a family. So these are consistent with the 2021 copays. Here's a slide just to talk about specialty medications. I talked a little bit about that before, but specialty medications are medications that are used to treat chronic, complex, rare, and sometimes genetic diseases. These medications can be injectable, infused, inhaled. Some are oral medications, but they all typically require some unique handling and distribution, temperature control, and a specific administration. So there's also clinical management required to optimize the safety and adherence for these medications, because they are used to treat these super complex conditions. So if you're a member on a specialty medication, you're using CVS Specialty Pharmacy, and the number for CVS Specialty Pharmacy is on this slide. So if there is a need to initiate a new specialty prescription, your provider, you can call CVS Specialty to get started. With CVS Specialty, members can choose to have their medications delivered to their choice of location, whether it's their home, their office, or you can have it delivered to CVS Pharmacy and then have the opportunity to walk into the retail store and have a conversation with the pharmacist when you pick up that medication. The CVS Specialty Pharmacy also has the pharmacy care team available for questions for members. So they can answer questions related to things like the order status or billing questions related to your specialty prescription, but they can also speak to questions around medication side effects, adherence, taking it with other medications. So they're a very great resource for members on the specialty medications. That care team can help them with a wide variety of questions related to their specialty medications. So next step for your members. So if you are notified by CVS Caremark that you're impacted by a change, as I noted earlier, that formulary changes, if you're impacted by, say, a medication being removed from the formulary, you'll receive a letter from Caremark within the next few weeks. on that letter, if your drug is being removed from the formulary, there will be alternatives listed, but we always suggest that you have a conversation with your doctor or your prescriber to see if there are medications that are included on the formulary that are alternatives or maybe generics available. So while the letter will indicate what the alternatives are, you can always have a conversation with your doctor about that as well. We also encourage members to check out our digital tools that I'll go over in a minute. So that includes our website for CVS Caremark and app, and CVS Specialty also has its website and app that I'll talk about in a minute. And then of course, we talked earlier about the availability of getting 90-day supplies through mail order to help save you money. So we encourage you to take a look at your prescriptions, use our digital tools like our website app, or call customer care to make sure you're taking advantage of getting a convenient 90-day supply. So as a quick overview, between caremark.com and the Caremark mobile app, there are a number of tools and resources that you can use to help manage your prescription benefit. So you can check for orders, you can move your prescription to mail order, you can look at your history of prescriptions. You can also use the website and app to use the check drug cost tool and the pharmacy locator tool, and also use the app to set reminders to stay on track. So to really help with adherence as well. So if you're looking for the CVS website, this is a picture of what the landing page looks like. So you can sign on to caremark.com, register with your account. You can use this site to submit a refill. And then there are also some tools that you can see up at the top for the check drug cost and coverage and locate a nearby pharmacy. So the pharmacy locator tool allows you to put in your city or zip code, and it will find pharmacies in the network in your area. So you can use this to sort through. And here is the link to where you can find the locate nearby pharmacy. And then the check drug cost and coverage tool is a great tool that I want to encourage members to take advantage of. So if you are being prescribed a new drug and you want to see how much it will cost you out of pocket, you can type in the name of the drug on the check drug cost tool on the website. And what is great about this tool is that if you are prescribed a brand medication and there is a generic available, this search will bring up the generic available. So you can see that you have the option between brand and generic, and it will also show you the cost differential. The check drug cost tool will also show you that you have available, if you have the option to have it filled in a 90-day supply, what it would cost to get through mail versus what it would cost to pick up at retail. So the check drug cost tool is a great resource that we will encourage members to use, especially when they're being prescribed a new medication, just to see what their options are. And here's the link for the check drug cost and coverage tool on the website on caremark.com. Here's a snapshot of what the Caremark mobile app looks like. And so similar to the website, you can use a lot of the same tools. There's the check drug cost tool. You can refill, manage your refills, manage your current prescriptions on the app. And you can also use it as your ID card, have a digital ID card by logging into the app. If you are a member or taking a specialty medication and using CVS Specialty Pharmacy, there is a specific website for CVS Specialty. On the CVS Specialty website, there is a new patient guide. It's a PDF document that you can download and review, and it just talks about all the services and procedures associated with CVS Specialty. It talks a little bit about that care team that I mentioned earlier. So we encourage any new or current specialty utilizers that have any questions to check out the website and review that new patient guide, because that can answer a lot of questions. Similar to the Caremark website, you can manage your refills online and check the order status using the website. When signed in, you can also contact a member of the CVS Specialty Care Team via secure message. So if you have questions for the care team, whether it's just related to your order status or perhaps a question around medication side effects, you can send a secure message on this website and a member of the care team will respond in that portal as well. CVS Specialty has its own app as well, specific for the specialty pharmacy. So similar to the website, you can use this for secure messaging and just send a message to that care team and they'll respond back via the secure portal. So you can have that conversation related to your specific medication. You can also use the app to update your delivery preferences. So if you want to have this delivered to your home, when you normally have it delivered to the store, you can use the app to update that. There's also some great features like the symptom tracking. So if you're managing a specialty condition and want to make an effort to track your symptoms for your next maybe appointment with your doctor, there is a feature in the CVS Specialty app to track your symptoms. And then there's also the adherence reminder. So just you can set a reminder to make sure you take your medication at the same time every day, just using this adherence reminder feature in the app. So there's a lot of great tools and resources available there. And then the last two slides are just some general terms you should know related to the pharmacy benefit. So a lot of this you're likely familiar with or have heard before. Things like deductible, copay, coinsurance, and out-of-pocket maximum. You hear about these terms with your health insurance or medical plan, but they're related to the pharmacy plan as well. We talked a bit about the types of medication, whether it's generic or preferred brand medication. We talked about how generic are the lowest cost alternatives. And you should always ask your provider or prescriber if there are generic medications available. Talked a little bit about your maintenance or long-term medications. So those are the medications that you're taking regularly, like high blood pressure medications, diabetes medications, and things like that. And that's compared to acute or short-term medications. So those are things that you take just for a short time to manage an illness, maybe like an antibiotic. There's also preventive medication that's covered at 100%. So under the Affordable Care Act, there are a number of medications that are covered at $0 member cost share. So those are things like contraceptives for women. There are some preventative breast cancer medications and things like that that are covered at 100% as a result of Affordable Care Act. And then there are some other features associated with the pharmacy plan, things like quantity limit, step therapy, prior authorization. So these are assigned to some medications just to make sure that the most clinically appropriate and cost-effective medications are being used. So quantity limit just means that there's only a certain amount of the medication that can be dispensed. Step therapy for some medications will require you to try one medication before you can step to another preferred option. And prior authorization just means that CVS needs more information from your doctor as to why a certain medication is being prescribed. And then things like dispense as written is referring to if your doctor writes dispense as written on a prescription for a brand medication, then the pharmacy can't substitute a generic, then the member will have to pay more when there is a generic available. So that's why we really encourage that you have conversations with your providers about generic options. If you have a claim that is denied, you have the right to appeal that decision. So if you have questions, you can reach out to the customer care team and they can walk you through how to initiate an appeal if you do have, if you do want to appeal a decision. And that concludes the prescription benefit overview for today.
Thank you so much, Lindsay. I would invite anyone who has questions to please post them in the chat. Lindsay, while we're waiting, I had a question regarding the CVS, the website, Caremark website, and you're showing those different links. So would an employee have to create an account to access that, right? On the website, they couldn't just log in or just go to the website and access those, could they?
So I'm glad you asked. So members can register and create an account, and that will allow members to see their prescription history and track things specific to their account. However, you can do a quick and easy refill without logging in here. So we suggest registering and making an account to really manage your pharmacy benefit. But these tools like the check drug cost, the pharmacy locator tool, and the refills are sort of in front of the registration link. So you can utilize that without logging in.
Great, thank you.
You're welcome.
Any questions from anyone in attendance? We appreciate the feedback. So we have a question. Are you able to use another neighborhood pharmacy with the Caremark card?
So yes, you can use a pharmacy that's not CVS retail pharmacy. So that the pharmacy locator tool will show you the pharmacies that are in network for the Prince George's County plan, and that is not just CVS pharmacy. So just because you're a CVS Caremark member doesn't mean that you only have to use CVS pharmacy.
All right, thank you for that. I'm going to post.
You're welcome.
I'm going to post some links in the chat. Certainly, you can continue to ask more questions. We have a few more minutes, but I want to post links to the benefits open enrollment webpage, benefits email and phone number, and then the Caremark webpage that's on the PGCPS portal. And then you can get to, there's information about the app and the links, and the caremark.com webpage as well is available there. And just as a reminder, folks, open enrollment does close this Wednesday, October 27th. So if you need to make changes and haven't done so yet, make sure that you log into local self-service to make those changes before the end of the day on Wednesday, the 27th. So any additional questions? A few more seconds here for folks to post. Again, thank you, Lindsay, for the presentation. Thank you, folks, for attending. Seeing no further questions, I will go ahead and end this meeting. We will be back at 5 for the similar or the same presentation, and we will then post a link to either presentation on the website later, probably tomorrow. Thanks again, everyone, for attending.
Thank you for having us.
Thank you. Yep. Bye, everyone.